Hello guys, welcome to my YouTube channel. Today I am going to discuss about the belly and love chapter wise tables and graphs. First chapter is the metabolic response to the injury, and we can see that here homeostasis, about the homeostasis, which is the normal physiology of our body. And to achieve homeostasis in elective cases, perioperatively it should be stress free. And if a patient is severely injured, then we can achieve homeostasis by resuscitation, surgical intervention and critical care. Effect modes and impaired immunity. अब आप लोग देख सकते हैं, ये नीचे जो ग्राफ है, ये ग्राफ जो हमें शो कर रहा है, जब अगर मेजर ट्रॉमा होता है, इन केस ऑफ मेजर ट्रॉमा वी कैन सी दैट मेटाबॉलिक रिस्पॉन्स टू द इंजरी इज इंक्रीज्ड, so graph goes upwards. In case of minor trauma, graph is just below the major trauma, so metabolic BMR is less than major trauma, so graph is below. When in patient goes in a starvation, then graph is in negative, below the normal range or in negative range. And second graph is nitrogen excretion. In case of major trauma, more nitrogens are excreted, and in case of minor trauma, less nitrogens are excreted. अब ये जो नेक्स्ट जो टेबल है, इसमें हम देख सकते हैं न्यूरो एंडोक्राइन रेस्पॉन्स टू इंजरी और क्रिटिकल इलनेस. जब भी इंजरी होगा तो उसमें न्यूरो एंडोक्राइन का जो हमारा क्या रोल होगा उसके बारे में है ये नीचे. तो उसमें दो फेज है, एक्यूट फेज एंड क्रोनिक फेज. एक्यूट फेज लास्ट फॉर आवर्स. इन एक्यूट फेज hormones like cortisol and glucagon increases and adrenaline increases, और ये जो शॉर्ट टर्म सर्वाइवल के लिए these are beneficials. In case of chronic phase, when injury lasts for weeks to days to weeks, then hypothalamic suppression occurs, or when hypothalamic suppression occurs leads to decreased level of hormones, decreased releasing hormones and decreased target organ hormones. And in case of chronic phase, when it lasts for days to weeks, then it causes sepsis, hemorrhage, massive transfusion will required, and patient will go into the acidosis, and this will further trigger the chronic phase. And lead to chronic wasting. Will occur. So this is the whole concept of this table. This diagram shows the integrated response to surgical injury. When injury will occur, then it will stimulate afferent neuronal pathway, and this will lead to stimulation of hypothalamic pituitary axis. This is the hypothalamic pituitary adrenal axis will be, we call it as HPA axis. When HPA axis is stimulated, then hypothalamus will stimulate pituitary gland. Pituitary will secrete ACTH, and anterior lobe of the pituitary having somatotroph, and this lead to, that is also called growth hormone, and lead to increase in growth hormone. And this ACTH will stimulate adrenal gland, and adrenal gland will secrete adrenaline and cortisol. And on effect of metabolism, ACTH and growth hormone will cause lipolysis, and cortisol will be secreted from the adrenal gland, and this will cause hepatic gluconeogenesis. And the pancreas will secrete glucagon, and this will lead to protein synthesis and hepatic acute phase reactants. And now pro-inflammatory cytokines will be activated, and this will cause inflammation and leading to pyrexia. These pro-inflammatory cytokines increases after injury due to tissue damage and plus immune activation. This lead to increase in interleukin 1, TNF alpha, interleukin 6, interleukin 8, and this will cause pyrexia. And these hormones will decreases insulin consumption and decrease release of insulin from beta cells, and increased इंसुलिन रेजिस्टेंस, क्योंकि जब भी बॉडी में इंजरी होगा तो ये जो काउंटर रेगुलेटरी हार्मोन्स है वो इंसुलिन को डिक्रीज कर देंगे, ताकि हमारे बॉडी में जो इंसुलिन ये ब्लड ग्लूकोज जो है ग्लूकोज का कंजप्शन डिक्रीज हो जाए, और जो इंजरी के टाइम में हमारे ब्लड में जो ग्लूकोज है उसको यूज किया जा सके और ये इंसुलिन कम हो जाएगा। एंड हेयर मोस्ट इंपॉर्टेंट क्वेश्चन इज वाई IGF-1 डिक्रीजेज। तो IGF इसलिए डिक्रीज कर जाता है क्योंकि जब भी इंजरी होगा तो इंटरल्यूकिन 1, TNF अल्फा, इंटरल्यूकिन 6 और 8 ये सब जब इंक्रीज करेंगे तो ये सब लीवर का जो ग्रोथ हार्मोन रिसेप्टर है उसको ब्लॉक कर देगा ये लोग, जिसके कारण डिक्रीज इन IGF सिंथेसिस will occur. IGF synthesis will occur. And second mechanism is insulin is required for IGF synthesis. And when insulin will decrease, then IGF-1 will also decrease. And last one is why testosterone and T3 decreases. Then the concept is cortisol will directly inhibit testosterone synthesis, and because testosterone is anabolic hormone, so during stress anabolism is counterproductive. And why T3 decreases? T3 decreases because cortisol and cytokine will inhibit 5-deiodinase. 5-deiodinase, and 5-deiodinase is required for conversion of T4 to T3 peripherally. So T4 will not be converted into T3 and T3 concentration will decrease. Metabolic response to the injury. This is rapid onset. Pro-inflammatory cytokines, interleukin 1, interleukin 6 and TNF alpha, broadly related to injury severity, and this is most severe in sepsis, burns and in cases of major trauma. और ये जेनेटिक्स के ऊपर भी वैरी करता है. दिस कॉजेज कैटाबोलिज्म, मसल ब्रेकडाउन एंड इम्यूनोसप्रेशन, एंड दिस काउंटर बैलेंस बाय एंटागोनिस्ट रेस्पॉन्स. लेकिन हमेशा ये काउंटर बैलेंस हो जाए ये पॉसिबल नहीं है, कभी कभी दिस काउंटर बैलेंस भी इम्परफेक्ट. और ये जो है सेप्सिस और अदर सेकेंडरी इंसल्ट के केसेस में मेटाबॉलिक रिस्पॉन्स जो है वो प्रोलॉन्ग हो जाएगा, मे बी प्रोलॉन्ग, एंड दिस कैन बी क्रोनिक ऑल्सो. एंड इन डेवलप हेल्थ सिस्टम associated with most late death will occur, but it will be late death in cases of developed health system. Now what are the purpose of this neuroendocrine response? So first of all is it will provide essential substrate and postpone anabolism and optimize host defenses, and these responses are beneficial in short term but may be harmful in the long term cases, especially to severely injured or critically ill patients. जब भी हमारे बॉडी में इंजरी होगा तो जो पेरिफेरल टिश्यू जो है वो उसे रिडिस्ट्रीब्यूट होकर के अमीनो एसिड सेंट्रल टिश्यू की तरफ जाएगा. तो इसमें जो मेन जो रोल प्ले होता है दैट इज द मसल. मसल विल प्ले मेन रोल, एंड प्रोटियोलाइसिस विल अकर इन मसल, एंड दिस विल लीड टू फॉर्मेशन ब्रेकडाउन and lead to formation of amino acid. So muscle is the main donor, and amino acid released, mainly two of the amino acid are alanine and glutamine. And why only these two proteins amino acid are necessary? Because these are the two main transport amino acid. These are the two main transport amino acid, alanine and glutamine, and these two amino acid will carry nitrogen plus carbon. Nitrogen plus carbon will be carried safely carried in blood. So these two are important amino acid. When these amino acids are released, then this central tissue will utilizes it. And liver, what are the uses of these amino acid in the liver? Then alanine will cause gluconeogenesis. This will cause gluconeogenesis in the liver, and acute phase reactants will be synthesized here. Acute phase reactants will synthesized here. And what are the uses of amino acid for immune system? Then main is glutamine. Glutamine is the primary fuel, and this is needed for lymphocyte and macrophage function. This is needed for lymphocyte and macrophage function. And in case of wound, amino acid will be required for collagen and tissue repair. Collagen and tissue repair. So these are the different uses of amino acids for different purpose. So these are the important. Through mnemonics, we can remember it as muscle gives, liver lives, and immunity survives. So this is the mnemonic. And now this skeletal muscle wasting. So muscle is the largest protein source, and these amino acid will come from muscle proteolysis, which is explained in previous slide, and these are mediated by ubiquitin proteasome pathway. So always remember, muscle is always sacrificed for survival. Muscle is always sacrificed for survival. And this ubiquitin proteasome pathway will be activated by stress hormone plus cytokines. So ubiquitin and proteasomes are two different terms. Actually, muscle proteins are tagged with ubiquitin. Muscle proteins are tagged with ubiquitin, and it will be degraded in proteasome. So these are the two different. So in normal adaptive response, there will be mild muscle loss. Some degree muscle loss will occur, but when sepsis occur, this will lead to persistent proteolysis. And when excessive muscle loss occur, then this will lead to excessive muscle loss will occur, then lead to decreased respiratory muscle strength, and this will lead to hypostatic pneumonia, decreased protein for healing. This will lead to poor wound healing, and this will cause increased morbidity and mortality. Now positive acute phase reactants are CRP. Here only one example is given, CRP. Others are fibrinogen, haptoglobin, ferritin, and alpha-1 antitrypsin. Negative acute phase reactants are albumin. Others are transferrin and pre-albumin. And these negative acute phase reactants are decreases because liver has limited synthetic capacity. So protein synthesis is diverted to positive acute phase reactants. Liver has limited synthetic capacity, so this is diverted to increase positive reactants. So always remember, liver saves life, not albumin. And this graph shows change in body weight that occur in sepsis. X-axis shows days and y-axis shows change in the body weight in percentage. Three situations are compared here: starvation, uncomplicated major surgery, sepsis, and multi-organ failure. In starvation, progressive weight loss occur, progressive weight loss occur. So this graph goes progressively downward. And why this goes downward? Because in starvation insulin decreases, increase in glucagon and cortisol. In case of starvation, first glycogen depletion occur and then fat utilization. So this weight loss is slow and linear. In case of uncomplicated major surgery, slight dipping of this graph, and then stabilization. Why this occur? Because in case of uncomplicated major surgery, acute stress response will lead to increase in catecholamines and cortisol lead to an uncomplicated insulin resistance will occur. So after a short-lived stress response, recovery phase occur. So this is a stress phase, and this is the recovery phase. So weight loss is modest and temporary weight loss in uncomplicated major surgery. In cases of multi-organ failure and sepsis, we can see that first curve goes upward and then slowly come toward x-axis, and we can see that here it shows weight gain, but this is not true weight gain because it is due to capillary leak, sodium and water retention, and aggressive IV fluids. And in cases of sepsis and multi-organ failure, albumin decreases, and when albumin decreases, then this will lead to edema, and this will cause weight gain, but this weight gain is not true weight gain. And why later this weight loss occur? Because patient will be in persistent hypometabolic state, and pro-inflammatory markers like interleukin 6, interleukin 1 and TNF alpha will increase. Insulin resistance will occur, proteolysis and lipolysis will occur, and lead to muscle wasting. So this is a hypermetabolic state, and weight loss will occur. Hypermetabolic and weight loss further lead to weight loss. So this is the whole concept of this graph. अब इस चीज़ को हम लोग इस तरीके से भी याद रख सकते हैं, इस ग्राफ को, स्टारवेशन सेव्स लाइफ, स्टारवेशन सेव्स, एंड सेप्सिस बर्न्स, ऐसे भी हम लोग इसको याद रख सकते हैं.